Running, walking, bending, and lifting. These are all everyday activities that many of us take for granted. But for those who suffer from back, neck, and leg pain, even the most mundane tasks can be excruciating.
Sitting was painful, walking was painful, and sleep was painful. The pain was constant. It did go away at times with the medication that I was on and after I started having some physical therapy, but that took quite a while for that point to be reached, but the pain was constant.
Millions of Americans like Darlene Yak suffer from similar conditions, and the cause can be any number of reasons, including herniated discs, spinal stenosis, instability, and arthritis.
Most people with pain often respond to medication, physical therapy, and it resolves spontaneously. The patients that don't, though, they need to be evaluated for that kind of problem, where the herniated disc is not getting better on its own. The spinal stenosis is pinching the nerve, is entrapping the nerve so much that it needs to be further evaluated.
In some cases, surgery is the only option for relief, and finding the right doctor is paramount when considering spine surgery. Doctors who perform minimally invasive surgeries are in great demand because of the procedure's high success rate and convenience for patients. The medical professionals at minimally invasive spine specialists are at the forefront of this field. Led by Dr. Patrick Sweeney, the entire staff is dedicated to enhancing patient care, safety, and satisfaction.
The benefits of minimally invasive surgery for the spine center primarily around less tissue damage. The incisions are smaller, there's significantly less muscle damage, and there's much less scar around the nerves. All of these lead to faster patient recovery and at the end of the day, better outcomes. Many of the minimally invasive surgeries, the endoscopic discectomies, the micro discectomies with tubular retractors, almost all of those are done as outpatients now, whereas the minimally invasive lumbar fusions with instrumentation, those are routinely 23 hours and at worst 48 hours. So the recovery time as far as post-operatively is much better, and patients start physical therapy much earlier in my experience, getting a better outcome.
As the inventor of several spinal technologies, Dr. Sweeney continues to be involved in advancing minimally invasive techniques, and investing in state-of-the-art technology further assists Dr. Sweeney in achieving optimal results.
The significance of this technology is that it basically is like a GPS system for your car, where the O-arm provides the patient-specific map, and the StealthStation provides an update of where you are on that map. So as your car updates in real time on a GPS system, the O-arm and StealthStation allows you to update real time in surgery where you are, where your implant is going, and verify that everything is indeed where you'd like it to be before you place it and before you close the patient.
The accuracy is just amazing. And then, when I get done with the surgery, I can do another scan and make sure it's all where I want it to be. It's been a remarkable change. I think that I'm giving the patients much more safety, improved outcomes, and just a comfort level that I've never been able to offer anybody before. At this current time, throughout the world, this is just now happening. Minimally invasive surgery has been becoming very popular over the last 5 or 6 years, but when you marry it up with this level of technology, very few institutions are able to do it right now. There's only 100 of these units in the country, and they're primarily at the big academic centers. But it's really been a step forward as far as this type of surgery is concerned, and I would expect over the next several years for this to become routine technology at most hospitals.
Darlene was a candidate for minimally invasive spine surgery and was operated on 5 months ago. Since then, she has seen outstanding results.
After surgery, it was night and day, 100% better. I felt, of course, where the surgery was performed, but the sciatic nerve pain was gone. It was a difference of night and day. I made steady progressive improvement, and 2 weeks later, after my first follow-up visit, the staff was amazed at how well I was doing.
When you see these kinds of patients, you become even more convinced that this type of surgery is the way to go.
As minimally invasive procedures continue to advance, Dr. Sweeney and his staff remain on the cutting edge, ensuring that patients get back to their old self again.
Our center here, the Center for Minimally Invasive Surgery in Mokina, Illinois, is focusing on minimally invasive surgery in many different realms. But now that we have the recovery center open with the 2-day stay, and the nurses that all work there taking care of the patients are all ICU trained or orthopedic trained, the level of safety and the comfort level is just pretty much bringing doctors to our door right now to get involved in this kind of technology and this kind of care. The patients are getting food catered in from local restaurants. They're watching large screens televisions. Occasionally they don't want to go home. But it offers for the healthy patient with a clearly definable problem, I think it offers a higher quality answer than hospital care. The risks of hospital stays, for instance, hospital-acquired infections, mistaken medications, that's all so minimized here because we just don't have that patient population. And in addition, our beds in the recovery center have special mattresses that are coated to prevent methicillin-resistant Staph aureus, which is MRSA. So we've really gone the extra step to provide a quality of care here that I don't think people can find anywhere else. The doctors really have control here. So as far as investing in cutting-edge technology and keeping this facility at the level it is now, which is the highest level in the country, that's our goal. Medicine and surgery are an art combined with technology, and you really have to practice both of them and stay on top of it to give patients the quality of care that they deserve.
For more information on minimally invasive spine surgery, log on to mispine.com.